So let's talk about protein intake after weight loss surgery.
3, 2, 1.
Here we go!
The word protein is derived from the Greek word protos, meaning first in rank or position, and that is for a good reason. Protein serves so many important functions in the body and is crucial for the bariatric patient to help maintain muscle mass during the weight loss process. And that is why it is important you meet your daily needs, and these needs will vary in each patient. Your daily protein needs depend on many factors like how much you weigh, how much muscle you have, and not just whether you're a male or a female. For post-operative patients, bariatric patients, including those who have gone under a gastric sleeve surgery, the recommended daily protein intake is generally higher to support the healing process and maintaining your muscle mass. Specific recommendations can vary and often based on, of course, individual needs. It is commonly suggested that bariatric patients consume between 60 and 120 grams of protein daily, and this has to be divided into several small meals to accommodate your reduced stomach capacity and to ensure that the protein absorption and the utilization is proper. For the general population, it is very common to hear that the recommendations like consuming 1 gram of protein per pound of body weight, especially in the fitness or the bodybuilding communities. However, the calculation is usually different for bariatric surgery patients due to their unique dietary needs and the restrictions following surgery. Typically, protein recommendations for bariatric patients are based on ideal or adjusted body weight rather than their actual body weight, just to avoid overestimation in cases of obesity. The general guideline for protein intake after bariatric surgery is often set at 1 to 1.5 grams of protein per kilogram of the ideal body weight per day. So here's how you can calculate this. Determine your ideal body weight. This might be calculated based on height and gender. For example, many of us in healthcare professionals, we use formulas like the Divine formula, which for men is 50 kilograms plus 2.3 kilograms per inch over 5 feet. And for women, it's 45.5 kilograms plus 2.3 kilograms per inch over 5 feet. I know your mind is going wild trying to calculate this, so I'll give you a more straightforward way to calculate this if this is too confusing. Go ahead and just Google your ideal body weight. There are some useful charts you can use. Now, converting kilograms to pounds is easy. Multiply kilograms times 2.2 to get the weight in pounds. That means 1 kilogram equals 2.2 pounds. Now, let's multiply your weight by the protein requirement. So multiply the ideal body weight in kilograms by the protein requirement, which is, again, 1 to 1.5 grams per kilogram per day. Let's do an example. A woman with an ideal body weight of 130 pounds, which is 59 kilograms approximately, the protein needed is 59 kilograms times 1 to 1.5 grams per kilogram equals 59 to 88.5 grams of protein per day. Then the next question I usually get is, well, how many calories would this amount of protein be? Well, all you have to do is multiply those grams of protein per day times 4. 4 calories. That means that 1 gram of protein equals 4 calories. Remember that with a restrictive procedure like a bariatric surgery, the amount of calories per day will be way less than an average person. So if this make-believe lady we mentioned with an ideal body weight of 130 pounds or 59 kilograms would need 88 grams of protein per day, we would multiply those 88 grams of protein times 4 calories, which equals 352 calories from the daily protein intake. That is a good amount of calories in a bariatric patient, since patients can't eat as many calories as a normal person. So leaving the rest of your daily calories for carbs and fat. So that is why I always insist my patients when they ask me about macros after weight loss surgery, and my answer is always focus on your protein first. And doing so will leave little room for the rest of the day for fats and carbs, and you will be just fine losing weight and maintaining your muscle mass. I hope this makes sense. Now, individual needs can vary significantly based on other factors like age and activity level and the type of surgery you had and your overall health. So additionally, the ability to digest and to absorb nutrients, including the protein, might change depending on what type of surgery you had. Therefore, you need to adjust your daily requirements in your specific case. Always remember that with your specific or for your specific situation, you need to adjust this with your healthcare provider, with your doctor. Okay, now you know how much protein you need. Now let's count or measure your protein intake. And for this, I highly recommend you start reading nutrition labels and be sure to use an app like MyFitnessPal to keep track of your daily intake. For more accuracy, you should weigh your cooked proteins just a few times so you can get familiar with the amount of protein in your usual portions. If you need to consume more protein, try meal replacements or protein shakes, which can tailor to your personal needs with additional protein powder or other protein add-ons like yogurt or cottage cheese or tofu or nut butter. Now, don't just focus on protein. Your overall dietary balance matters too. So be sure to add plenty of healthy carbs like fruits, vegetables, whole grains, beans, as well as good fats coming from nuts or avocado or vegetable oils. Okay, so there you have it. Did you like the information? If so, if you can leave me one of these, greatly appreciate it. Helps us out with our YouTube algorithm here with our account. And don't forget to subscribe for more videos related to weight loss surgery. I'm Dr. Álvarez with Endobariatric.com, where we are changing lives one sleeve at a time. Take care and God bless.